Good afternoon, everyone. Welcome back to the fourth episode of Soulful Conversations. Today, we have here a very special guest. He was the former alumni of our school head boy from the batch 2004 2005. And right now, he's here today in front of us as a highly reputed doctor in Amrita Hospital, Kochi. Welcome, sir.
Thank you so much. So I think it's a huge thank you for inviting me. I never thought I would come back to interact here. I do occasionally come till few years back. I've been coming quite frequently, or in between at least, to meet the teachers. Um, Last few years, I've been a bit busy and have not been able to come to Trivandrum as frequently. So I think this opportunity, I thank Rekha teacher for giving this opportunity, and all of you to be here. I think post your um, school timings. I think, but it'll be a relief for you. I think you're supposed to have extra classes, right? So I think then at least we'll have some informal discussion. So I think be as informal as possible. So that way I'll also be able to open up much better. You can also interact with me as much as is the time permits. So I actually, I'll just give you a brief background if you have not been made aware. I actually did my schooling here from the 7th to 12th. Um, Before that, I was studying abroad in Abu Dhabi. So I joined here actually from 7th. So I think most of you would have joined here from 1st onwards. So most of you are here from 1st to 12th. I joined during high school time, 6 years in the school. So 11th and 12th, 12th I was the head boy and of this school. My sister is also an alumni here. She was 2 years younger to me. After that, I did my MBBS in Amrita Institute of Medical Sciences in Cochin. So after that, I have been in Cochin. I did my specializations and my subsequent degrees and all that in Amrita Hospital. Right now, last 8 years, I'm working as a consultant there in Amrita Hospital itself. My family is also there. Wife is doing her nephrology education. My daughter is 3 years old. So we are settled in Cochin. But again, thank you for the opportunity to come back here, go through a few nostalgic moments. All the old teachers, many of them have left, but at least many of them who are here still receive us with such warmth and love. Thank you.
Thank you, sir. So it's almost been 20 years since you've last been here, right?
Yeah.
What is that
It
feeling?
makes me sound very old, but yeah, I think it's 20 years now. So I think like I said, school is something that you will always, when you come back, you will not be like whatever you do. You'll do a few once you pass out, you'll do a lot of higher studies. But the moment you come back to that school where you had that immense, like I said, I've studied in other schools also. I did actually till my 6th standard. I was in Abu Dhabi Indian School. Then for my year completion, I was in Bangalore Public School for a few months just to complete the year, and then I joined here. But the experience here from 7th to 12th was totally different. The kind of bonding that you have with the teachers, with your friends, is totally different. So I think the moment you come back to this venue, you are always overwhelmed and full of emotions. It's a very good feeling. It's a very nice feeling to have, and it occasionally reminds you of your roots.
Yes, sir. So, you're a radiation oncologist specialist, right? A very highly reputed doctor. So, what is being a doctor all about? We've heard stereotypes, the typical doctor has no personal life whatsoever. But what is really being a doctor about? What is your career in general?
So I didn't want to scare you by telling the specialty, but okay. So I actually specialized in radiation oncology. Like you know, I think oncology, do you understand what oncology means? What does it mean? Cancer. So it's related to cancer treatment. So it's a specialty that's related to treatment of cancers and general other tumors as well. So generally, you can treat cancers in few basic techniques. One is always doing a surgery, removing it. You can give medicines. So the third method through which you can treat cancers are through radiation. So radiation is basically ionizing radiations like X-rays, gamma rays. You can use these rays to focus in that area of interest and still kill the tumor cells. So I have specialized in that field of medicine, which I think even during my MBBS days I was not completely aware of, but I knew oncology as a department is there, and that is the specialty all about. So that is what I do. Regarding why I became a doctor, so I think being a doctor, for me at least, it was not a very personal. I was not very passionate about being doctor. It was basically, I don't know now nowadays how it is, but at that time when you pass out of your 12th, you have two courses, engineering and MBBS. Your parents will give you two options. You choose one of them, and whichever. So I was okay with it. So I was reasonably good at studies, and I was okay with both. So I liked maths as well as I liked biology. So for me both was okay. So I wrote both exams. Engineering also I was able to get in some college nearby, but medicine was what my parents at least wanted me, because there was no doctor there. At least their rationale was that there is no doctor in the family. There is no doctor in the family, so you can be the first doctor in our immediate family at least, and that is why I chose that specialty. But again, I wasn't aware of the intensity of the course that you have to go through. So I think MBBS, like nowadays it is quite aware that it's a very tough course that you have to go through, 5.5 years of training, classes, clinics, and then internship. And then after that, again, that doesn't stop there. Each time your parents will tell you this, after this, then you have finished your studies. You can then become a professional, but it never ends. After MBBS, then you have to do again 3 years of one more specialization, then again 3 more years of another specialization. So after MBBS, at least I didn't want to go for a long specialization. I wanted a specialty at least, because nowadays, at least in this current era, being just an MBBS doesn't give you the options as much as when you do a specialization. So now everybody is specializing. You have to be focused on one particular area. So you can become a doctor, but you still have to specialize in one particular area. That gives you the better chances of being a good professional. So that way I was looking for a lot of options. And then I wanted a course which will finish within 3 years, and then I don't need to learn any further. I can start working, and I can be done with studies. So that is the main intent. Then as usually we write the entrance exams, and I think 2-3 specialties I got. One was anesthesia, one was pathology. Then I got this radiation oncology in Amrita Hospital itself. So these 3 options were there. I got pathology in Vellore as one option. So again, I chose this oncology specialty because of 2 things. One, I was quite intrigued by this specialty, that cancer care, at least in that time, cancer care was a very intriguing specialty. Patient interaction was one of my main priorities, that I should have enough that is what, as a doctor, at least excited me. During my MBBS days, apart from all this by hearting and reading and writing exams, the stress that you go through the exams, the interaction with the patient and that time that you spent there was what gave you that satisfaction that you want to continue. Otherwise, you have to find. So I think any profession that you go, not only in MBBS or in being a doctor, any profession that you go, you have to find that one thing that excites you about that course or that specialty or that profession or whatever, that career. So unless you have that, it's going to be a very hard to continue in that profession, because whichever, even if being a doctor, being a business entrepreneur, everything is quite hectic. Nothing comes for free. You have to work really hard for getting that. So I think that was the one factor. The second factor, I felt it like a destiny. That was the seat I got, this one. My father is a cancer survivor. So when I was quite young, I think when I was in the fourth standard, when I was studying in Abu Dhabi. So that was one of the reasons why we came over to Trivandrum. He had a throat cancer, which actually was cured and treated at Tata Memorial Hospital in Mumbai with radiation treatment. So kind of in destiny, I was also being pulled towards that same specialty with which my dad got cured. He's now 30 years since diagnosis of that cancer, and he's a cancer survivor. So that was again um, what made me desire that I need to follow that oncology specialty, and that then you go through the course and come out as a pass out. And then I was lucky enough to get a consultant post in the hospital that I was studying itself. And now last 8 years I've been able to do some reasonable justice to my profession.
Thank you, Doctor. When we were talking earlier, you mentioned about a generational gap, right? So currently, this generation is all about one thing, artificial intelligence. And I think Ishan has a good question related to AI and cancer. Ishan?
Good afternoon, Doctor. My question for you is, in this age of AI, how can AI bring changes in your field of specialization?
So I think artificial intelligence, like you know, is now a big part of at least your day-to-day.
And it is changing a lot of careers in a way.
True. But I think at least a doctor, AI can help speed up a lot of things, at least in our profession. Wherever you don't need direct patient to doctor interaction, probably there AI will help a lot. Because that simplifies our job a lot. Because as a radiation oncologist, one of my main work is to do planning. You have to plan the radiation treatment. Then at the same time, you have to find time to interact with the patient. So that the mechanical part of the work, that is the technical part of the work, which even a trained junior can do it reasonably well. That probably AI will definitely help speed up the process. And then you get enough time, because most of the time what you see is, at least in our specialty, we have to spend time with the patient. You have to address their concerns, you have to address their questions. They might have a lot of family, social issues to discuss with you. You might not be able to do too much to that, because finally you are just a stranger to them. But you give them that space to disclose all those things, somewhere to open up. That gives them the self-healing kind of situation where they will, their stress will come down. A lot of uncertainties. Sometimes it's a very good prognosis, but because there are a lot of cancers which can be completely cured, especially early stage cancers. But problem is, the word cancer just triggers a huge overwhelming kind of stress among themselves, the emotional turmoil that they have to go through. So if you can spend time with them and give them the space to ask their questions, and you can clarify those concerns, that actually helps them a lot. So I think AI is going to clearly AI can't take care of that part. That you need the human touch.
There are some things that AI cannot dominate over.
So that human touch that you need to, that emotional touch, that understanding, you can't interact with everybody the same way. For a cancer being diagnosed in a 10-year-old, in a 20-year-old, a 30-year-old, in an elderly patient is totally different. You have to know how to interact. For a young child, the child doesn't understand the concerns of a cancer. There it is the parents that you have to take into
yes,
confidence.
but the thing is, in a lot of professions, AI has completely, and I mean completely dominated over. So are you giving an assurance that in the field of medicine?
It's very unlikely. So the doctor-patient relationship is something that AI can't, or AI at least in the near future can't take over. And I don't think any of the patient would be satisfied by talking to I think you would have seen movies, no? I think there is some...
there is a recent trend of iPad hospitals.
So problem is, it is like Google. You search with your symptoms, you will get this. But you will get a diagnosis which will be sometimes very alarming. But it might be the simplest of diagnosis as well, which is completely curable. So you're unnecessarily, the patients will be going through a stressful evaluation process.
You know, there are some limits for all things, and I think AI does have a limit in medicine as well.
Definitely, definitely. Unlike other, so wherever you need mechanical processes where the technical aspect is involved, probably. So like if a radiologist scans are being done, so interpretation of the scans, those things can be quite fast. So the physician or the clinician or radiologist or even in our specialist, the oncologist, can spend more time for more important things. So that way AI is definitely coming into the picture. Wherever machine related learning is involved, AI is still having a huge role to play in the field of medicine. But it is very difficult to replace the patient doctor interaction. There AI, it will be very difficult to intervene.
Thank you, doctor. Mm, let us say every person, you know, there is that one person who has influenced a person in one way or the other. Is there any person who has really influenced you?
See, I don't. It's very difficult to find one person who has influenced you. I think it's a lot of things. It's I think from your family. It starts from your family. The values that your family instills in you as you grow during your childhood. The teachers in your schooling, the teachers that you interact with. The in my MBBS days, there are always kind of doctors whom you look up to. So the way they interact with you. So you learn from all this. Even you learn what not to do also. There are some physicians who interact in a very rude way also because of their personality. That is again something that you should learn not to do. So I think it's a culmination of all these small things.
Inspired from the surroundings.
Yeah, I don't think I've been inspired by one person as such. It's always been, my philosophy has always been expose yourself to as much as possible. Learn what you can from every possible situation. There is a learning in every experience. Even if it's a bad experience, even if it's a good experience, there is something to learn out of it. Sometimes it might be how do you overcome that bad experience. Sometimes it might be a good way of doing a particular thing. So you learn from everybody, even if that person, you don't like that person, you don't like interacting, but that you have to forcefully go and attend his classes or attend that person's OPD, you have to sit with them, you have to interact with them. You might have seniors, especially in the medical field, you will have seniors who will guide you. You have to interact with them. But there is always something positive to take out of each interaction that you have with everybody. So I think you have to have, if you have that, you will slowly build your own personality. You will add something, you will understand what weaknesses you have. You will find, okay, this person is doing this in a better way. Why is he doing it? What is he doing different that I am not able to do? And you will pick on those things, and that you will start implementing in your life as well and in your way of doing things. So I think you shouldn't have one role model, you should have multiple role models, and as more the role models, the better, because you will find better, more, because every individual is different. You will find one quality in each individual which is valuable and which you can take impart in your life as well.
I think after this session, you'll be one of our role models.
So, see, role model as such is a very big word to use. I think as long as you can influence somebody, as long as that interaction or whatever interaction you have with your teacher, your peers, if that is influencing you, that is a good thing to have. Whether it is but you have to realize, is it a good influence or a bad influence? That is the only thing.
Sir, as a doctor, I believe stress is a very common thing for you, right?
Yeah, it is stressful. I think the education course, the current medical culture in India is totally different. I think if you have friends who are doctors abroad, you will know the difference in the way the medical culture is currently in India. So the teaching, I think you will always see in the news as well, a lot of bad things happening, unfortunate things happening in the medical fraternity. Stress is a huge part of it.
And sir, your specialization is oncology, and I think Anna has a question regarding your profession and stress. Anna?
Sir, according to you, how does stress contribute to ailments like cancer?
See, I think we have found a lot of things that cause cancer, but stress is not something that is directly related to cancer. Um, so I think what the stress does is, so it is not just like an acute. Everybody goes through a stressful environment. Like you didn't do well in the exam today. You have a stressful environment. That is not going to create cancer or a very
I
bad
think
influence.
that question arised is because, in a lot of cases, when you go to treat for some disease, doctors are like, kind of reduce your stress.
So
Stress is common for everyone.
So stress is what stress does is it is not directly linked to any this one, but stress, the way you respond to stress is what is the difference. I think the way when you have an acute stress, what do? You will sometimes talk to somebody. You have a difficult emotion that you want to handle. You will talk to your parents. You might talk to your best friend. You might talk to your teachers. They will calm you down. They will tell you that this is just a passing thing. You will overcome this, and you will. So that calms you down. Problem is unaddressed and chronic stress. Chronic stress, which is continuously not addressed, and which is probably sometimes difficult to detect. Maybe the person is not showing it clearly. So sometimes it is very subtle. You don't realize it. Um, those kind of stresses, what they do is they change your habits. They change your general health. It affects your general health. So a healthy person is somebody who is going to live long, and it's very unlike, and it's most of the time cancer cell doesn't have the freedom to survive in a healthy body. So basically, all of us have these kind of these what we call, basically what is cancer? It is a abnormal cell which has in your body, which has gained that potential to just keep growing without any restriction, and then it starts spreading through all your body. That is basically what a very simplified form. So the starting form of this cell is there in everybody. It is your cells that age, the cells that abnormal cells is there in everybody, but your immunity and your inherent immunity takes care of these things to a large extent. So the stress, what it does is it affects this. The general functioning of your body is kind of affected. You might, because of the stress, you might take up unwanted habits like smoking, alcohol, which are not good for your health. The diet, it affects the diet. Diet is a huge factor to consider in cancer. So these are the things so stress indirectly affects all this. And this is what then over a long period of time. So it is not that in one moment you have a stress, the cancer cell is good. That cell is there. It takes many years for that cell to change into a tumor and then start manifesting itself where you can see it or you can feel it. So stress is something that is an important part. So it is important to do with your general health. If your general health is good, the probability of these cancer cells coming is good. If you have good healthy habits, if you have the way the medicines actually act on your body also has a lot of impact. So that is why the doctors generally tell when the patient comes, we want you to be stress-free, because even exercise is a huge, very important component of your general health. So what happens is when you're stressed out, you don't have the desire to do anything. You don't have food on time. You don't sleep. Sleep is very important. So sleep is when your body is actually recovering. So sometimes what happens is studies, stress, everything, you don't sleep at all. Your general health is going to really go bad. And that is when these kind of illnesses, it is not only cancer, any illness. You might have headaches, you might have insomnia, you can have, so whatever general illnesses come, all can be attributed to some extent to stress, but they are not directly related, it is indirectly related. So stress-free environment is something that is very difficult to have. So I think you will have stresses, you will have stresses throughout your life. The way you overcome that and how you can manage the stress is what is going to be successful. So even during MBBS days of doctor, while working as a doctor, we have so much of stress that is there, which we have to find ways to overcome that. So I think, so stress, you don't need to worry too much about stress. Just don't let stress control you or take over your life. That is what you have to know how to control that stress. I think you have a lot as students now. You will have, I think, 10th standard exam is coming, and after that 11th, 12th. It's a lot of decision making to be done. You have a lot of you have to satisfy your parents' decision interests also. You will have a passion in your own this that you want to pursue. So there are going to be conflicts. There are going to be stress related to that, and realize that life is that stress is not that there's no problem that is not solvable. There is a solution to everything. It is just the way how you approach that problem. If you can approach that problem, sometimes the way that you are approaching it might be creating more conflicts. Sit back, look at the problem from a different point of view, different perspective, and then you might be able to actually solve that problem with a very small intervention, or a very minor intervention. So there you will always have friends, teachers to guide you there. So I think don't submit yourself to that stress. Stress is going to be there. Take it as part of life, and move on. Try to move on from that stress. I think that you will all learn through that process. Just don't let stress take over your life. You have to take on. So it is all in the mind. So finally, it's all in the mind. Different people use different ways. Some people use prayers. Some people use meditation. Some people just confront that problem head on. So whatever it is that keeps you calm and your stress at control, I think that works best for you. So everybody has their own individual ways of overcoming stress.
Yes. I'm pretty sure you have heard all these stereotypes about doctors, that they have no personal life, no time, nothing. And I think Livon has a good question on that.
Since you said about a lot of professional life, I'm relating to your personal life now. So how do you maintain your personal life, like work-life balance in your personal life? How do you maintain?
Okay. This work-life balance, I think very recently a lot of people have put it. I think when we were studying all this, there was no concept of work-life balance. So like I said, at least the current medical culture is a little bit strenuous. The course as such, how it is designed and all that, the working culture, everything for a doctor, it's not that easy. But like I said, I think what I would tell with regard to work-life balance is, you have to be able to, so you have to choose your profession or your career in a way that there is something that excites you in that. There is some passion that you have. This work-life balance issue becomes a major problem when you have taken up a profession where you don't like it. It's basically, what is the difference between work and job? What do you think is the difference between work and job? Are they both the same thing? So job is something that, like she said, job is something that, if you want to clarify a little more, you can probably give her the mic. She wanted to say some more.
I think work is something you do when you're passionate about it and you don't feel bored and you're excited to approach it every day. Well, job is something you do for the sake of it or for financial issues.
Yeah. So work is a very generalized word. Job is any work that you do which gives you some income. So the main purpose of doing a job is the income that you get. For that you're doing it. It's not because you might not like that work, you might be bored of that work. So if work, the work or the professional work, that job is a work that gives you income as well as you're passionate about it, or it is something that excites you daily to go, today I need to go work. Coming back also, you'll never feel tired. Even if you work for 18 hours, 20 hours, you will not feel tired. I think your father is a doctor, right? So I think if you ask your dad also, I don't think people who are very passionate about being a doctor will not tell that I'm tired after coming back. They might have worked for 12 hours, 24 hours. So there is a physical stress that is, and I think that is what many of the hospitals utilize also doctors. They make them work for 24, 36 hours because you finally know there is some amount of service involved. So that gives you genuine satisfaction of taking care of patients, interacting with patients. So you never feel tired. Job, even if you do for 6 hours, when you come back, you will feel tired. That is when you feel the need for a personal, or you want to do some other activity which gives you personal satisfaction. So that is where this question of work-life balance comes. So if your work is part of your personal life, which gives you joy, which gives you satisfaction, which gives you a thrill, and you feel quite satisfied after coming back from a day's work, I don't think you will really need another personal time for yourself, because you will find satisfaction then. Then always it is there. When you have a family, it is slightly different. You have now, it is not only about yourself. You have been only thinking about your personal part now, but you now have to think of your wife, your child, your parents. So that is always there. You have to find time. So that my wife is also a doctor. She is also, so you can understand at home how it is for a 3-year-old kid to see morning, we'll say bye and go at 8 o'clock and then come back. I at least reach home by 7 o'clock in the night. My wife, if she has duties, she comes the next day morning. So it's for her, so we have to find time for that. So that we genuinely have to do. We have to make that effort to balance your hospital life, which is part of your personal satisfaction, versus your family time. So I think that is definitely important, because you have to cater to their needs. The needs for a 3-year-old daughter is not the same as for your parents. So you have to find time for that, and that we all have to do. There is no work, or it is like if you have something that is very important, you will find the time. It's not that there is no time. There is always time, but it has to be important enough for you. If it is important enough, you will find the time for that part of your life as well. So just like we find time for patients and hospital, I think we are finding, at least we make the effort to take a holiday, take a break, once in a while go out, be a part of social groups. Sometimes what happens is you might not take the initiative. Especially me and my wife are people who find very difficult in taking initiatives and then going and interacting in a social function. So you become part of certain social groups where you are expected to be there, and then you will find the time for that. If it's an optional thing, you will always sit back and relax at your home in your, or you will go back to hospital again to do your work. So I think you have to find, so I think work-life balance is important, but I don't think you need to stress too much over it. As long as at the end of the day, you are enjoying most of your moments that you go through the day, you have the capability to plan, execute, and do the things that you like. And again, hobbies is a very good thing to have. So find time for, always, you might choose some profession, but always have some hobbies which you can always entertain yourself with. You sometimes have to entertain yourself rather than entertaining others as well. You sometimes have to find your own time. So I think sometimes music, at least for me, music, sports is something that I find satisfaction. So whenever an opportunity comes for that, I'll always be in the forefront trying to be there present. There's a cricket match happening, I'll be there. I might not be a good player, but being in that team, that environment makes a huge difference. It gives you clarity of thought. Maybe you might have worked continuously for 2 days, continuously with duties and all that. Again, it becomes a point of where you can unwind and regenerate yourself. So you have to always find time for that. And that, again, is going to be the key in a profession like being a doctor, where you have, so, and it doesn't mean that all doctor professions are like this. Okay, there are certain specialties which are very relaxed also. There are 9 to 5 kind of working specialties also. So I think it's for everybody. There is something, some people are involved in research. You might not like sitting and interacting with people. So there are a lot of my friends who are looking at research oriented. So it's like an office work. You go there, 9 to 5 you work, come back. There's no duties, there's no night duties, there's no emergency cases, there's no surgery. So it depends. So whatever gives you, so finding the specialty and finding that career path that gives you the satisfaction, that which thrills you or gives you the satisfaction at the end of the day, is what is going to help you maintain your work-life balance. Otherwise, it's always going to be a struggle. You will just for the namesake do a job and come back. Then you will never, you'll be too tired to find time for your family or your other personal hobbies.
Yes, I think you're just trying to say that it won't always be 50-50, right? Your work and
You
life.
can't have 50. It's like I think recently there was all this, in this marriage it has to be 50-50. There's no
Yes.
50-50. Some days it is 60-40, some days it's 70-30. Sometimes the days that my wife is too tired, I have to take 90% of the effort.
Yes, I understand. Because there are times when I don't see my father for 2 days, 1 week straight. But then he always, in the end up, makes for it, even if it's just 1 day with me.
True. So I think you'll all have anybody whose parents are doctors. So you have a few. So I think you will all relate to that quite easily as well. How meaning the lifestyle is totally different. You find some, but I think most of us, at least in the doctor community, are making efforts to find that balance. So you can only do that if the work that the hospital-related work that you're doing is also giving you personal satisfaction. Then you will have enough. Then you will have the energy when you reach back to spend time with your family. Otherwise, you will always be too tired to do anything. You might have 12 hours remaining because your work might start at morning 8, and finish at 6 or 5. You still have the whole night to spend time with family for your personal activities, your personal hobbies, or whatever gives you additional satisfaction. But if you're too tired after coming back from a job, mentally tired, it's not about physical tiredness, it's always about the mental tiredness that you go through. If that is there, you will not have the patience or the initiative to do that. So I think, so don't stress too much about work-life balance. I think choose a work or a professional career which satisfies you. And then you will be able to find time for the remaining
Because
things.
then automatically all the other things,
Other things
including
will
your
follow.
personal life, will be easy.
Yeah, so you will find time for your personal things because you have, it's not like you're going to work once you, maybe while you're studying you might do it, but once you have become a professional, you are not going to work 24 hours continuously. You will work 8 hours a day, 7 hours a day. Even if you're in an IT field, you will have you will have space where you can be relaxed. Problem is utilizing that time. You should be in a mental state to be able to utilize that time. You should be in a space of mind where you find, okay, I've got 3 hours, I can do something, I can write something, I can read a book, I can listen to some music. You should be in that mental space to be able to do that additional activity or that extra activity that you feel satisfies you or your family. You want to go for a movie, a 3-hour movie, you can find time for that. It's not that you can't find, but you should be involved in that moment. If you're too tired, mentally tired, you will do it for the sake of doing it, but not really enjoy it. That is when it becomes difficult and you find a lot of stress coming through, and it manifests in different ways. So like I told you, stress you will manifest sometimes as anger, sometimes as depression, sometimes as crying, sometimes as in different emotions. It will come out as in different emotions. It might not come out at that point where you are experiencing the stress. It will come out at a later point in a different scenario. So that always at the end of this, so what I try to do is at least my specialty is such that I have to go through a lot of emotional things from the morning till evening. So I try not to bring that back home. When I'm back home, I'm not thinking about those things. So you have to, if you're not, you have to be in a space of mind that you can come back home and then I can interact with my child and my family without having the burden of that morning stress. So that I think you'll all find. So I think the key point there is to be able to be happy with what you're doing. If you're happy and you're satisfied with what you are doing during the day, you will always be happy when you go back to sleep.
Yes, I think it's time to change into a more lighter atmosphere, not all about work and stuff. So, you were an alumni of the school, as very school head boy. You have walked these corridors, these exact corridors, right? So, Isha, do you have some question about his school life?
Actually, sir, I aspire to become a doctor. So my question will be not on your school life.
Parents are also a doctor.
My dad is a doctor.
Doctor.
Yeah. So, like, what will your advice be if I decide to specialize in radiation oncology in the future? And does it pay well?
Again, I told you the reason for choosing to be a doctor shouldn't be the status it gives you. It was at least when I chose being a doctor, it was one of the main things was parents were looking at a steady income, and you have to the meaning when you tell in your family that you are a doctor, my son is a doctor, my daughter is a doctor, you have a particular status in the society. That used to be that is the story 20 years back. I think now I don't think doctors have that kind of a status in society. Neither is the income that attractive to choose it and choose all the stress that I've told you about during studies and never-ending studies. Your friends by the end of 3 years, they might already become 3 or 5 years post-engineering, they might have already started some business, started earning income. You will start earning after 10 years once you have become a professional. So the time that it takes you to start earning is also late. And what you earn is only going to be half of what maybe a person with a small entrepreneurship or a business or even in the IT sector, or somebody who is actually good at financial things. You have now so many other avenues where you can earn more. So income and the status in society should be the last things currently, at least in the future generation, if you're looking at being a doctor. It has to be the love for the that taking care of somebody, healing somebody, being there. It doesn't have to be healing also. Many a times when I'm in oncology, at least, you know that maybe 30% of them are curable. Many of them are not curable. Many might be coming in the last stages of this. It's about being with them, the empathy that you can share with them, the satisfaction that you give. If that gives you personal satisfaction, gives you personal, you are more inclined towards those kind of things, then, and you feel passionate about doing it, caring for somebody, looking after somebody, just helping them go through that stressful. And sometimes it helps you, even if you look at a friend who is very stressed, you talk to them for some time, that person becomes very calm, relaxed, and she feels very relaxed after talking to you. You will also feel automatically glad that, okay, I was able to do something good, or something I was good, a good person for that individual. So that is also something that has to excite you. So I think being a doctor, you have to love the profession. You can find medicine is a very wide specialty. Okay, it's not only about patient interaction. You might find something interesting in research. So just like you don't have to be. Sometimes people find it. I know a lot of my friends who find it difficult to interact with patients, talking about these very difficult things, emotional things. It's not your stronghold, or you don't want to discuss it in detail. So maybe that is you have many other specialties in medicine where you don't need to have a direct patient interaction, like radiology or very anesthesia. You have non-clinical subjects, pathology, where it's more of the diagnostic dilemma, the thrill of reaching a diagnosis. You go through a lot of investigations and finally you reach a diagnosis. That gives you the thrill. That is what you're passionate about. Then that is something. Research, finding something new, finding a new drug that works, a cure for cancer, something new, something very innovative. If that is it, there is space for that also. So you can do this all after being a doctor. So it doesn't have to mean that now the word doctor. Previously the doctor, somebody was there, one of my friends who does non-clinical subject. When we ask them, are you a doctor? Yeah, but are you seeing patients? No. So that era has changed. Previously, if you tell your relatives you're a doctor, they obviously think they'll come to you with a lot of illnesses, scans, x-rays, and all, and say, "Mone idu nokkittu parney idu enganeyundu, allengi blood test nokkittu onnu parney, idu ellam kolappumundo, endenkilum kolappumundo." So maybe you're not specialized in that. You might be doing research. So I think now there is more awareness that a doctor doesn't mean just seeing patients. There are so many other avenues. So you don't have to but you have to find that. So you can become a doctor, But by the end of being an MBBS doctor, finishing your MBBS, you'll go through all these most of the colleges now expose their students, just like how you are being exposed to a lot of new options, career guidance programs. You'll see that engineering and MBBS is not the only two options like we were exposed to in 20 years back. Now there are so many other options. You can become an entrepreneur, you can become a CA, you can do Air Force, you can go work in the ship, you can be an engineer, you can be a civil engineer, you can do in construction, electronics. There are so many different avenues, even in engineering or in being a doctor. So these things are, so I think that should be your, when you finish even literature is so much rewarding now, arts. If you are a good singer, if you're a good painter, there is now options, or there are rewarding options. So previously everybody did not want to go through those fields because there was no avenues there, how do you approach, how do you reach that place. Now if you are a singer, you have different avenues, there are different platforms through which you have nothing to be done. You have a YouTube channel, you can and you will be, if your content is good, you can be an influencer, you can be a social media influencer. You will earn enough money, more than what a doctor earns by just being a influencer in that way through social media. So find what is your this. It could be anything. It could be literary, it could be arts, it could be something as studious like being a doctor, engineer. It could be chartered accountant. It could be just fine. There are a lot of people. I'm not sure if there are classes on financial literacy. That is something that I currently really feel should be there in schools. Are there classes on financial literacy things? You have to, because I think it is something that is being missed right now as an adult, looking back at when I have a family and all that. Financial stability, how to achieve financial stability should be taught, because most of the time why we take decisions which we don't like is because of financial reasons. There is no financial benefit by following a profession like singing. It's too much competitive. You don't know when you will create a band of your own and become well known. You might have in so many other specialties where you would not have a job per se. That concept of having a job is not there anymore. If you have the enough financial literacy, you will always find a passive income to create, and you can then pursue your passion and your interests. If you are financially stable by the age of 30, 40, you don't need to compromise on anything just for the sake of making income. So I think that is something, especially in the doctor community, it is very, at least nowadays, there is some this. At least now we are starting off in the MBBS days for our MBBS students to at least start off. But I think it can even start in schools. At least the basics of, meaning putting apart 2 rupees, 5 rupees, or even your pocket money that you have, putting aside, that is the basic, that is the starting point of any financial stability. Put aside a few rupees or a small amount starting from this age. You will see that at the end of 10, 20 years down the line, you will not be that financially or you will not be that poor that you have to take a decision or compromise on your passion. So I think that is also something. So money doesn't have to be current, at least in this current generation of students and this current generation, money doesn't have to be the main priority. Previously, when I chose a profession, or many of your teachers chose a profession, it would have been money was used and a steady job, a full-time job, or that somewhere which is a steady government job with steady income coming in every month. That used to be the thrill that we used to get when see your account fall every beginning of the month, a salary falls. That used to give us satisfaction. But that is not the case nowadays, because we are not in a age or an era where you have to be that behind money. If you follow your passion and you have the basic common sense to have some financial stability, by following your passion, you will already start making money and having a steady income. To at least, basically, what you want to lead reasonably good quality of life. You don't want to be Ambani or somebody. So if you want to just, if your intent is to just have a steady, have a good quality of life, I think that should be more than enough. You don't need to, so some people can't take, so like we were talking, at least I think the students whose parents are doctors, you would have had some exposure to what a doctor's life is. People who don't have that can't even probably think of, okay, working for 12 hours morning to evening and then coming back. I can't do that. I need to take a break once in a while. I need to go around, travel. So you sometimes, some people, their passion might be traveling. So how can you travel if you have a steady job? So I think there are now avenues to, you have a lot of role models to look up to. You have a lot of people who are following that path. So they have already started and shown you the path. You just need to find that one, that person or that role model to follow, and you can always, there is always that path has been cleared. You just need to now find that path, choose your path, and then follow the path that has already been laid down. So being a doctor, I don't have any problems. I'll always encourage, because you need more people who can be, but you have to be passionate. Don't be a doctor just for the sake of doctor. That is where many of these conflicts with doctors also happen. Sometimes it's all about miscommunication. The doctor's too busy to convey the right thing in the right manner. Sometimes that is also a reason for many of the issues that happen. So if you want to be a doctor, be a good doctor. Choose your specialty, which is your strength, not just for the sake of your parents or for just because that gives you more income.
So, doctor, when I saw you come here earlier, all that you were in the staff room, all the teachers were just so excited to see you. Everyone was looking at you with so much adoration. How did you feel?
So I think like I told you, I've not been here from 1st standard to 12th standard, but I think 7th to 12th, this is my time here in Christ Nagar School has been one of my most precious moments. I think my personality evolved while, so right now, if you recollect, I think today also Bindu teacher was talking about the time I cried when I got a very difficult question in the maths paper, I think in 7th or 8th. So that is how sensitive I was. I was a very sensitive person. Because exams and all used to give me that much stress. A small model exam or a class test also, if I don't do well in that test, I'm going to, it's like the end of the world, that kind of. So I think a lot of that has to do with the environment that you have, that you have been built up. Class test fail aya bhayangara prashnanu, veetti chellan pattilla, PTA meeting prashnangal. This that is there. So that sense of embarrassment, that you feel when you are made to stand in the position, that is something that was always very troubling. I was very sensitive of that, and I tried my best not to make a situation where I would be in a position to be embarrassed or my parents to be embarrassed. So I always was quite stressed about exams, paper, this class test and all, and used to be a very silent, quiet person. I was basically an introvert to some extent. I liked to keep to myself, but in my friend circle, I will be as open as possible. But in an unfamiliar situation, in an unfamiliar surrounding, I am very quiet. If you go to functions at my place also, I am the one who sits in one corner with my father without even moving around. So I used to be that kind of a person when I came here in my 7th standard. But I think what the teachers, at least here, what I felt was that is why I think that much of love even I have for the teachers here. They all remember 20 years later me by name. Not only me, my batchmates also. The whole class, they keep asking about how is he doing, how is that girl doing, where is she now. So they remember us by name. So that kind of an unconditional love that you get, that you will get only, usually you will get only at home. From your parents and your siblings, you get that unconditional form of love. That is something that I at least, I had studied till my 6th standard in Abu Dhabi Indian School. So it is a totally different culture there. The culture that we have here in this, at least in this school, is where I studied. And most of our schools in India, you have that bonding between students and teachers, which it is purely unconditional. There is no, you might be a student who is mischievous, you might be a student, and it is mostly the mischievous students that all the teachers remember also. So they will remember them. So what you generally refer to as backbenchers. So I used to be neither a backbencher nor a front bencher. I used to be the middle bencher. So I used to enjoy both. I wanted to be like them, the backbenchers, but I didn't have the courage to do it because I didn't know, okay, next day they'll call my parents and I'll be in a situation where I'm embarrassed and I have to justify myself. So I used to be there. I liked what they were doing or the kind of the kind of vibe that they have. Front benchers they are also studious. So I have to be good in studies as well as I want to enjoy a bit of vibe of that, but not get personally involved in any of those things. So I used to be in the middle, watching both ends and trying to imbibe as much as what I liked. So as we go 8th, 10th, that is when I think slowly teachers, I don't know what they saw in me, but they started giving me each responsibility. Okay, today, this year you are the class leader. I don't know if I was the quiet one, that is why they thought, okay, the mischievous ones, you can't make them class leader, so this guy is quiet, let him be the class leader for this year. So I think that what always has made me do well is whenever I'm given a responsibility, I try to do it to the best of my capability. So I think that is something that all of you have to take up responsibility. So at least now I have the courage to take up responsibility. Previously, it was forced upon me. Like okay, this time you are the class leader. I'll tell the teacher, no, I can't become the class leader. You have to become. This year, you are the class leader. You have any problem, you come and tell me. So teachers are able to see something in you. Because you might not, you are at an age probably where you might not be able to do too much of introspection, see your strengths and weaknesses. But your teachers will guide you through that phase till you're 12. Because after 12th, it's a total different scenario. You are not in a protected environment no longer. This is a very protected environment, a very safe environment where you can explore yourself in any situation. So it is always good to have that kind of a space in school. So that gives you that courage to take up responsibilities, go through, and finally, after 10th, I think I started being a little more open. Till then, I was always confined to myself, and meaning I'll do all the work, but mostly confined to myself with my friends. That is the circle that used to interact. But I was no longer meaning I'm not at all a good speaker. I have huge stage fright. That fear of going on stage was too much that sometimes I just go blank on stage and just stare the walls. That I was that kind of a person in 9th, 10th. But slowly teachers gave me small opportunities to within my class. Okay, you just small. When you're a class leader, obviously you can't sit and just sit down and you have to be in the front. So those kind of responsibilities slowly helped me discard those inhibitions that I had. So I think that is a huge change in my personality that I've had while in the school. Finally, when I was in 12th, they somehow selected me as the head boy. I don't know for what reason, but they felt again probably, okay, his studies.
What about that stage fear when you are head boy? Head boy has to always go up on stage and all that.
So I think after 10th, I was slowly, I think the teachers were also giving us, so I think this, the cultural fest that we have, no, all this, it's still Apollo Everest Expo. Okay. So that's that 4 houses, that division. So then when you're divided, and you have to remember that time there was only one class. 11th and 12th there was only one division. Okay. 10th there were 2 divisions. That is all the students there were. So 11th and 12th we were one batch of 60 in one class. We had one class teacher, only 60 students, one class. So you have to finally from that only you will have to, so when the numbers are less, no, you will be involved in something. You have to be involved in either the dance, the song, this and all. So something we started becoming, you have to, because that team spirit comes in when you're in one group. When you're divided among multiple classes, sometimes it's difficult, but at least within that class you will have a team spirit. So that helps a lot in overcoming these fear of stage fear and all that. And I think small opportunities started coming up, and we were, I along with some of my friends, so my first thing was always to overcome stage fear. I'll only choose group events. If it is group song, I'll go only for group song. So I think singing was a huge, that was one of, I could sing a bit. I didn't get any official meaning. I think when I was in Abu Dhabi, I learned for 1 year or 2 years. But after that, all my training was here. So I think the music teacher will ask, who all can sing. I used to sit down. I was not confident enough to, I don't know what they are going to make us do. So then finally, a few of my friends went and they said it's a group song. There is one more slot, you can, if somebody is there, you can still come. So then I thought, okay, group song, no, I can go. You can still, even if you make a mistake, it might, I think it will be difficult for them to pinpoint who did the mistake also. So we went for youth festivals as part of this group. So I think Jomon sir, who is no longer with us, he was one of the main, main person who was able to identify that possibility in me, and then you come, we'll find time for practice, you come, and it's a group song only. So we used to go around for youth festivals, cultural fest, the intercultural, inter-school, the choir groups. So the music was a big part of how I slowly started overcoming stage fear. So when you're part of a group, it's easier. That stage fear is not as severe as when you're standing alone. So I think that was a huge turning point. And I think gradually over a period of time, when these small these cultural fests happen between each houses, then the competitiveness is quite high. So there are some items where nobody goes. There are some, I think, I've not studied Malayalam, meaning I've not been taught Malayalam in a class. So what I speak is what my mother has taught me, and my mother tongue is all I know. I don't know the grammar of Malayalam. Nobody has taught me. I have not written a Malayalam exam. Finally, in 12th, to participate from Everest House, there was nobody in the 11th and 12th section for Malayalam, or there was only one person for Malayalam extempore or something. Finally, just to participate, I went in Hindi extempore, English extempore, and Malayalam extempore. Malayalam extempore, Jay Bhushan sir will sit and look at you. Along with Malayalam extempore, English will come. Little bit of other words will come. So I think that by the time I was 12th, I felt that because it's a part of the team spirit, no? You're doing it not for yourself. For yourself, you will never stand in that situation. But when you want to do it for your team, when you want to do it for your house, when you want to do it for a larger purpose, that time I was able to discard those inhibitions and just stand. Even if I'm getting embarrassed, it's okay, but participation is there. And finally, because there were less people, I got third prize also. There were only 3 people, so they had to give me the third prize. And the house gets points. That even if it is third prize, there is some points. So even when I went to MBBS, I was in my medical college also, I was able to do that. There will be always some program where there is nobody participating, because sometimes you need 3 people to at least conduct the event. So sometimes we'll just go and be there, embarrass ourselves, it's okay. For a larger good, it's okay. So I think that kind of team spirit was always there within me. Maybe I think the teachers saw that, and that is why probably they made me a head boy, because there are so many other students who are better speakers, better good language or literary has not always been my strength. I'm not a very voracious reader, writer, or a orator to speak well. But I think I was able to get everybody together. When there is an event to be done, when there is a deadline given to us, okay, you have to participate in these things. As a group, I was able to be a part of a team quite easily. So maybe that is what I think, and that I think is one of the best, I think the most important quality as a leader you should have. That you should have that quality to be part of a team. You can't stand outside and just give instructions to everybody. That is not a leader. You have to be a part of the team. You have to be a member. So then I had to change myself to be part of, because I can't be introvert sitting in one corner and then telling my other colleagues to do everything. So I think that is, the school experiences are quite, I think it'll never end if you start talking about school experiences. But I think what you will enjoy your time here, I think this is one of the most unconditional friendships and supports. So even many of my friends, we don't keep in contact that frequently. But whenever we see, there is something that sparks inside. No? You just start off where you left off last. Maybe you saw 5 years back. But that one hug and that one conversation starts, and then you might sit and talk for 3-4 hours continuously. So I think that is something that you will only realize when you leave school. But I think till then, make the maximum friendships, love your teachers. They will anyway love you back. Keep interacting with them even after you pass out. And I think that will help you in a lot, help you a lot in your future as well.
Yes, I think Krishna had a question about, becoming office bearers. Was still in 10th and we haven't gotten that chance to be an office bearer. So,
So you were an office bearer in your 12th, right? So what will be the message for the future office bearers?
which is us.
So I think, office bearers, you have to understand, first when you're being chosen as an office bearer, I think you have to have the humility to understand that you are not somebody special. You're not somebody very special from that whole group of. Now, in a 10th or 11th, how many students totally? Three divisions.
11th there are 2 classes, 12th also 2 classes.
2 classes. So I think around 100 students are there, or 60.
70.
70 students. So we were 60 students in one class. I think you're divided into 2 classes. So I think it's not you're not somebody very special. You've been just assigned the role to look over certain things because the teacher feels you're responsible. You will follow up the certain things. You have the basic discipline to follow up and make sure things get done. That is why you're the leader. Otherwise, it's not because you're very talented or you're this. So sometimes teachers see something in you. I think they made me class leader and all just to make me break out of my shell. I was in 9th, 10th and all in a very silent space in my own world where looking after. I think I'll interact with friends, but I'll never come out and be open and be involved actively in other things. So sometimes teachers do that. They might see a potential in you, but they know that there is something that is restricting you or inhibiting you, and they want to do it. So there could be multiple reasons why you are made an office bearer. But I think the most important thing it has to be is that you have to have the humility. There shouldn't be any ego inside you just because you're an office bearer. You can't just keep ordering people around because you have been put in a position of power. So I think that is something that even in future, once in any whatever profession you choose, when you become a leader, when you are the boss, you can't, or in a small group also you can become a leader. You might be a team, you are the leader who is guiding them. You have to not have that ego has to be let go to be able to, only then you will listen. So to be another important thing that an office bearer to be a good listener. So I think being a good listener has to be one of the main. I think you have to be able to listen to your peers. Sometimes what happens is when that leader role comes in, you want to take the call. You want to take the decision. You want to be the one deciding. It could be you could have a decision, but I think it's always, sometimes we miss out hearing others' opinions. So somebody who is who's not a good listener, you will not express, there'll be a lot of good ideas that come up from a lot of different people. But they might not express it just because you will not take it. But if you are willing to give them that space to, so sometimes what we do is in a group meeting, we individually ask each other, okay, do you have something to say? Do you have something to say? And you should be the last person talking. After having heard all the remaining people's opinion, you should finally, have the decision. So from a school point of view, probably that is where your teachers will help you. But at least I think that should be there. You should be able to listen to everybody's views and opinions and then take a final decision with the larger picture in mind. So here, as 10th standard students and 11th standard students, you might not know the larger picture. That is where your teachers will always guide you. So I think ego has to be, you have to throw away that ego that sometimes will come up when you are suddenly appointed an office bearer. Sometimes you know you are the best in the class. You will have that air about you. So I think that has to, I think humility is a huge important factor. But you should be strong-minded also. You have to be opinionated. If you have to have your own opinions. And once you have taken a decision, stay by that decision. not wavering from your decision. So I think those are one of the few things as a leader you should have. I think basic qualities. There are different types of leaders. There are very imposing leaders. There are very outspoken leaders. There are very, like, just if you look at your Indian cricket team, you have captains who are there throughout. Like, everybody is a different. Dada will be leading in a different way. Rohit Sharma leads in a different way. Virat Kohli leads in a different way. MS Dhoni leads in a different way. Rahul Dravid will lead in a different way. So they're all good leaders. There are different. So that is your personality that takes over. What is your personality that you can't change. So that is finally what will emphasize. But at least these are all something that you have to have in common is this, that ego, be a good listener, don't feel scared of opportunities. I think that is something again here by my school. I was always scared to take up responsibilities and opportunities, but my school time here as a head boy and all, we were able to, like, I was forced to go on the stage. I have to go on the stage. I have to go prepared. I'll sit with Roni ma'am or Loretta ma'am the day before, and the speech, everything will be corrected, checked, and you have to practice. And then, so that is how I'm not a very spontaneous speaker. I go prepared with the sheet and go there, and then with that only I can read. If that paper is not there, I'm not confident to read it also or speak on stage. So many a times this is what has happened. So I think that being a leader has to be, these things have to be there. I think you have to be innovative. I think you still have those flaps. So I think to my knowledge, our batch was the first one to introduce that flap. We saw in few other schools also using it, and then from our batch onwards, we started having flaps for all the office bearers to just stand out. So that gives you the pride, no? Because many of them were not willing to become office bearers, because and even if you are an office bearer, you don't take it seriously. But now when you have that, you are looked at differently, you will automatically behave differently. You will make sure, am I behaving in a way that is worthy of being a leader? So those things and that will change you. So I think those are also things that as a leader will help. So be innovative, don't worry about failure, embarrassment, take up responsibilities, stand by your decisions. Even if a mistake has happened, if it is your decision, take responsibility for those actions. I think those are the things I think as a leader, even future office bearers who are looking up to it, I think you should have these basic qualities as a leader.
Geetanjali, do you have something to ask?
Yeah, I do. So, doctor, you were here for around 6 years, right? And while you were here, you became the head boy. So, how did the values you incur while you were in Nagar reflect or contribute to your professional life or just your life in general?
I think one of the biggest positives that I've had after coming to this school,
team spirit.
Yeah, I think you have to be part of a team. So that was inculcated in me from here. That how do you become part of a team? You have to have. So you might have to take sacrifices, make sacrifices, do things which may not be in your nature, but it is for the larger good of the team. So that is something that is going to be definitely in any profession that you take, not only a doctor, any profession that you take, only teams will flourish or will grow together, because multiple people working towards the same goal, that is what is going to reach faster than you one as a single person pulling everybody and taking them along to a goal. So that has to be, so you have to know how to be part of a team. For that, I think you have to be a good leader. Only a good leader can become a part of a team. So a person who is inherently a leader by nature will automatically be part of a part of a very good team. So I think teamwork is something that I've learned a lot from here. Communication skills. I think as a doctor, something that you have to have is communication skills. Like, I have not learned Malayalam as such, but most of my patients I have to speak in Malayalam. So being familiar or being comfortable with a language that you are not very confident of, but you have to convey the right message in the right tone, in the right emotion. You can say the same thing in different emotions, but for that patient at that point of time when you're sitting in front of you, or even if it's a friend, even if it's a team, and how you criticize. So that is how to do positive criticism is something that is very important. You have to convey the right message in the right tone. You can criticize by making it look like it's the other person's fault. But you can say it in a very good manner also, in which the person who's hearing it actually thinks, okay, there is something, that is something that we can correct. So those are also some things that, so how to take criticisms is something I've been able to, because I was not somebody who was willing to expose myself to that criticism. But over a period of time during my 11th and 12th as a school leader, making mistakes during speeches, making errors, sometimes even whatever the different programs that we have been a part of, you slowly overcome that inhibition and it's okay. So next time I'll make it right. So you have to have that, so that helped me a lot while becoming a doctor. While my regular interaction with patients, that is a huge thing. You can't fumble while talking to a patient. No? So you have to have clarity of thought. So that, I think the stepping stones for that were while in the school. And 10th, 12th, when I was the head boy, I had to take extra precautions and extra efforts to make sure those mistakes are as less as possible. So I think that is one of the main things. And then I think I developed my hobby of singing, sports, all that from here. So while I was school in Abu Dhabi, I was not at all interested in all those things. But here, when I saw, look, there is opportunity. There is a youth festival. You have a lot of opportunities to go and I think you still go to La Fest and all? Yeah. Okay, so it's still there. So La Fest, we used, when I was the head boy, we had gone there. We became runners up that year. The next year, for our juniors, we stayed back. And during that La Fest time, we came back to guide. So after we passed out, a lot of us came, the drama, skate, dance, everything, we also helped them choreograph. And I think that year we brought home the trophy. So those kind of team spirit, no, that our batch was quite good. And as you said, we were, as you know, that we were one batch of 60. So it was a good experience also. So that teamwork is something that I've really enjoyed, and I try to, wherever I go, I try to do. Teaching is also, I think being a doctor is all about teaching also. You will have a lot of junior students under you, students from different branches coming. So how do you talk to them in different ways? The way you talk to a first year student is not the same way you talk to a final year student, is not the way you talk to your colleague, is not the way you talk to somebody who's specialized in some profession or in a person who is outside your profession. So I think that also, how to teach and learning. The learning and teaching process is something. So I always learn by teaching. I learn something, then I teach my friend. So that is the way I learn. So that is something that has always been a part of my learning process here. And I continued that when I was doing my MBBS. And even now, when I'm a consultant and I have students under me, I do the same thing. So these are few things that as a doctor I feel that Christ Nagar School was able to inculcate in me in a big way, and that still continues to help improve myself over these years.
Yes. Pallavi, did you have a question?
Yes.
How many of you are actually want to become doctors? Okay. 1/4 of the class. That's
And most of it's because of the, a lot of stereotype, the strenuous effort you have to take.
So I think whatever you choose, it's...
You got to love what you do.
What was your question?
You got to love what you do.
Yeah, so finally you have to know your specialty. So many of you, I think all of you have parents as doctors, is that why? Or is there anybody who's taking up doctor profession just by, or wish to take it up due to the keen interest in it? So many a times I think doctor's profession is being chosen because of parents' insistence many a times. But I think it's something that is very valuable to the society. So I think even if you're taking it with the insistence of your parents, or even if you really want to, but you're scared of the work that you have to put in. But I think at the end you have to enjoy the benefit that you're going to give to the society. You have to understand that you're contributing to the society in a big way. The health system, especially in our country, is one of the best that we in world over. Only issue is the work culture is quite difficult. So I think you just have to accept that fact.
Good afternoon, sir. A few of my relatives were diagnosed with cancer in the recent past, so I would like to know whether there are any ways to detect cancer in the earlier stage, and also are there any facilities in India that can help detect cancer in the earlier stage?
I think India is quite, I think very few tests are there world over that is not available in India. So I think India is quite in the forefront of cancer treatment as well as medical health care. So cancer problem with cancer is there is no one test that you can test and tell that you have cancer. So or you have the early stages of cancer. Like I told you, it's an evolution. There is a cell that gets formed. It takes many years to evolve into another phase. Then it becomes cancer. Sometimes they are in the pre-cancerous stage and they might just get cured on its own itself. Sometimes, and many of these pre-cancerous things will get converted into cancer. Now, there is no one test, but you can focus, there are screening tools. So we refer them to as cancer screening. So there are cancer screening methods, but they are focused to specific cancers. Like if you want, so one of the most important cancer screening in our country is the breast cancer screening. So breast cancer is coming up in a huge way, even in young population. So there is now guidelines set for how you should do. You should do a mammogram, how frequently. There are specific guidelines put. Problem is how many of them are aware. It is the about because we are a huge population. It's very difficult to infiltrate this knowledge to every part of the world, part of India. Unlike in the developed countries or in the Western population, where almost everybody is quite aware of how to take care of health, what are the cancer screening programs, because everything is public health. The public health takes care of all that. Whereas here, you have to spend your money. You have to invest in your health. So sometimes it's not that easy. For you, sometimes survival becomes priority than health at certain times for certain people. So, or you don't have the time to invest in your health. So I think that is the first thing, that you have to find time to invest in your health, take care of your health, have all, like I said, a stress, or you can't have a stress-free environment. You will always have a manageable stress environment which is not affecting your mental space, good health, good diet. All these are things which can help to some extent prevent cancers or delay the cancers. But once you identify them, you still have to use specific cancer screening tools. So like for breast cancer, it is a mammogram that you have. Many cancers are still like cervix, gynec malignancies, you have these kind of pap smears which you can do. So a gynec health checkup regularly with the pap smear. Ovarian cancers, the colorectal cancers of the intestines, large intestines. Cancers of the large intestines are also something that can be done screening. Lung cancer, regular chest x-ray once a year, prostate cancer. So there are very specific cancers and you have to do specific tests to identify that specific cancer. You don't have one single investigation which will tell you whether you have cancer or not. So that is the problem. There are so many cancers which you can't identify through screening at all. So, but the problem with the screening is there are so many cancers which if you diagnose early, you still can't do anything about it. You might, so these cancer screening tools are meant for cancers where if you detect them early, you can change the outcome. There are so many cancers where you can't change the outcome, even if it's in the early stage. So there it is unnecessarily you're putting the patient through a lot of investigation. So sometimes that is the other drawback of these promoting cancer screening is also that the patient has to be aware what they are going through. So if you start doing this for all cancers, do a scanning every 3 months, do some scanning every year, a full body scanning. This becomes a very tedious process. The individual is going through a very stressful environment. Every year during health checkup, they are worried, okay, do I have cancer, do I have cancer? So it's an unnecessary stress that again invites more issues, more health issues. So rather than that, I think there are very specific cancers which we know that if we detect them early and there are good cancer screening tools available and you can change the outcome of the disease. For those cancers, I think there are good cancer screening tools which are very cheap. They're not very expensive. It's just a blood test or others. In future, we might come. There is something called liquid biopsies. You can just test the blood, look for DNA of this tumor cells. This is all under research, and maybe 20 years down the line, we might come up with a blood test which can tell you whether you have cancer or not. But as of now, we have cancer screening techniques, blood tests, X-rays, which or ultrasound scans, very very simple tests, which to some extent can tell you whether you have a very early stage cancer. Then something else that you can always look at the family history. If you have a genetic predisposition, you can always, if you have a strong family history, always you have to start screening much earlier. So in that case, it's okay. But for an average person, it's very tedious to put them through all this cancer screening and maybe the person might not even develop cancer till the age of 70. But from 30, 40 years onwards till 70 years, he'll be doing a scanning and testing every year and going through the stressful environment of that stress of knowing whether there is cancer or not. So there are very specific cancers which you can do cancer screening, and I think that is what the government also currently recommends to do that. Anything beyond that is a very personal, individualized decision.
Yes, we're coming to the close of this wonderful session. I hope you've enjoyed interacting with us, sir.
Yeah, see, I interacting, I tried maximum now to interact because, like I said, I still sometimes like to stay with myself. So now when I have junior students and all, I have to interact. So it's nice to interact with you. I've been interacting with her also for quite some time before the meeting. So I think you all have very clear, what I've understood is you know what you want to do. There is some clarity of thought. You have now good guidance, because, like you have, everything is there on the net. In my time and all, we hardly, in my home, we didn't have internet and all to go and look at what are my job options, what can I do with this passion. Sometimes you have a passion for something, painting. How can I take this forward to the next step to take it as a career? So now you have all those options. So you can search in the net, your teachers are there to guide you. Everything is freely available. And so I think you all are in that kind of a situation where AI is also being used to help you out. So you already have that in you, that you know what is your next step. But I think you have take the advices of your teachers, then to help you in the path that you want to go. Because sometimes you have to, so choose your profession or choose your anything in life which is passionate, about which you are passionate, about which you would like to do it on a daily basis. The moment you start hating or you feel it's a very strain to go and do that particular job or particular work, I think you should slowly find some other options. So and be free, meaning you don't have to do, sometimes what happens, I might get bored of being a doctor after many years. It might, I'll look out for other options. So you have to be flexible enough to realize, give yourself the few years. Suppose you want to attempt some goal. Like I think you had last time also few entrepreneurs and who cleared the prestigious exams. So I think if your aim is there, you want to do it, give yourself time, keep that I'll work for this for 3-4 years. If I'm able to achieve this, well and good. If not, don't be disheartened by failures. You will always have, there are so many opportunities in this world to live. You will never, you don't need to think that it is the end of life, that I didn't get MBBS, or I didn't get to become a doctor, or I didn't get to become a CA or a civil service servant. There are so many other options, and you just have to look inside you to see what are your other, because there is no one interest that you have. You will have multiple interests. It is just that you have prioritized one interest over the other. So I think that, so you will first obviously go your first interest. If that doesn't work out, you will always have multiple avenues that you can do. You will find maybe new interests. Maybe you were not exposed to those options earlier during your school days, once you pass out. So always be open to change. I'm somebody who I'm not at all comfortable with change. So that's why I feel that at least nowadays, I think the students that I interact with, they are very open to change. They don't mind. They don't want the same thing over and over again. They want change to keep changing. They don't, that the consistency makes it boring for them. So, but I think you have to have that urge to try new things, try new opportunities. Don't be scared of failures. Take up responsibility for your actions and put your full into. Do anything that you are doing with a full sincere effort. Be true to yourself. I think that is all that I can be. At the end of the day, be happy. Be true to yourself. Be as genuine as possible. And then I think life will take you through where you are destined to be. Okay.
Thank you, sir.